Now try another good breath through there. Good. Now I'll just get a little bit here on the quadratus. There we go. Good, right there. Very good. Come right in there. It's that 12th rib. I want to try to get a little more active today. That's good. Yeah, now we're down on the rib. Good. See if you can get that to move when you breathe. Perfect. Yes. Yes. Once more and I'll get out of there. Very good. Very good. Okay. Now, put your legs together here. Let's see. Got a pillow. Let's use this pillow. That way you can push down on your leg without worrying about. I've never heard of that. Somebody sleeping with a pillow between their legs. There we go. And this one was tied up all the way down, but it's from that hip injury, I think. Yeah. There we go. Okay. Now just let that leg go forward for a minute so I can get down here on the lower leg. It's interesting, this leg doesn't have as much definition in it on the side here as the other one did. Bring your toes up. That's it, and reach down with your heel. Good. And back. And up with your toes again.
Up, down.
Yeah, up. That's it, so you stretch right in there. Good, and back down again. Turn your toes up again. Okay, come back down. See if I can just, see if you can handle me just started camping here for a few minutes. If you it's too much, you tell me. Sorry. Let me see if I can come at it this way. Is that better? Okay. Now toes up. Yeah, try to stretch through there. Okay, you got it. Right in there. And relax. And once more, right there. Good. Pull that down. Right there. Good. And back. Now let's see. See that movement again now. That's better. Put just a little bit here. Okay. Now, bringing these back together for a minute. Right in here. Sort of, yeah, drop into your knee a little bit there. There, you got it. Right there. Another sore spot. That's it. You got it. Mm-hmm. Fall right into there. Good. Okay. Now. Let me see. Turn to your back now for a minute. Turn to your back and let me take this pillow away. Yeah, let me take a look at your legs here for a minute. Okay, let me bring your arm straighter here. Got you. There we go. There we go. Okay, there's still something that's got this leg twisted. Right there. And there. Find your little toe. Not your little, yeah, keep your foot lifted on the outside. Easy. Let the weight come down. There. There. Can you let that line a little longer right there? Okay, right there. Good. Okay. Now let's have you turn back to your left side again. I want to check this upper leg just a little bit here. Just right there. Bring your toes up again. And reach with your heel. Right in there. That's good. Yes. Okay. good. I think that right there is another part of this injury. Did you feel it go through or not? To that side? No. Huh? It felt like it was tied up from the right hip there. Right there. There we go. Okay, let's see this knee go forward now, back and back. Yeah, that's good. Now come back onto your back again, please. And your knees up. I want to check the way your weight's coming through your legs here. Your feet have changed. A little wider and a little longer right there.
It's not comfortable to wear any of the old shoes on.
Yeah. There. And let your weight come through the inside of your foot. Yeah. Right down through there. Good. See you rock back on your heel with this foot and down and back again. That's good. Okay. Try that with this one. Feel the difference. You feel the difference in the two? Let's see. There we go. This one has a little harder time getting over to the inside edge. There we go. There we go. Okay. Now let me just see you turn your pelvis and lay your head down flat and turn your pelvis under. No, just a little turn up like this. That's it. And then down. But a little subtler than that. And once more. Okay. Let this leg down. Let me see if I can get in here without you. Yeah, keep the other leg up. Yeah. It won't get much worse than that. That's it. Mm-hmm. Just let your leg out from clear out there. Good. There we go. There you go. Okay. Abdomen sore, huh? Let me just see if I can. Yeah. Right there. Let that leg out.
Up.
No, just let it. That's it. You got it. That's it. Just let it hang out long from there. It's that little twist in your lumbars that I was looking at. Yes. Good. Right there. Right there. Yes. Okay. Now both knees up. And I want to work with you a little bit seated, but let me see if I can get your head feeling more comfortable for a minute. Okay. Drop your head from my hand there. And see, take a good breath. And fold your hands on your belly down there. I'll get a chance to get up here next time when I get your arms a little better. But you do suffer from your occupation up in here. You need to get a computer with a keyboard that's about the size and height of your fifth rib there or something. Or I don't know what would do it. Maybe standing at the keyboard would do that. But who can stand for 4 hours?
What's your opinion on the chairs that you kneel on?
Well,
Kneel forward.
If you're having a lot of trouble, maybe they give you a little back relief, but you're never going to get one of us to tell you that you're better off without your feet on the floor. Floating on your knees up in the air doesn't give you very much. No, those benches that where you really rest on your knees are real comfortable for some kinds of people that have fixed back problems, but I wouldn't recommend them for anybody going through this kind of work, because your body's going to be better balanced with your feet on the floor. And those things don't have your feet on the floor. You know, you're sort of floating up in the air. There we go. Let your head come back right there. Okay. Now stay away from the ear there, but you've got to let this head come back a little more right here. It's not sore out in here, is it?
Yeah.
Okay. I'll stay away from that. That's it right there. Okay. I don't want to do very much there until next time anyway. But I would like to get your head back up a little bit higher than it was. There we go. Yeah. Yeah. So much of this right here is coming out of your arms. We'll get that next time when we work on your arms. You'll certainly like the next one, I think. Now, I'm going to give you pelvic lift, and then I'm going to do a little work with you seated. Just let your tail turn up. Now, that's right. And drop right here. Just a little thicker on that side, remember? All right, got into your coccyx there a minute ago. It's right there, and it's There we go. That's right. Let's see if we can get that balanced. Now let's come over to this side a little bit. Yeah, let that drop down right there. That's right. Good. Okay. Does that feel nice and flat? Let me find the bench here. Swing around to the side of the table there.
This side?
Yeah. Come around. I want you to sit on this thing, but I'm going to move it up against the table. There, you can sit right there. Yeah. Now, let's go forward just a little bit on the bench. There. Come up nice and tall. Let me see you go clear forward. Okay. Find your legs and let your head drop. Yeah, the inside of your left leg. See if you can meet me right here. Very good. A little more. That's it. Right there. Yes. Okay. Same inside of your left leg. Let your right armpit get a little wider. Yeah. Right there. Good. Mm-hmm. I come back up. Yeah, now push up with your legs. Come up straight, but use your legs to come up. Yeah. Okay. Let me come along here and see if I can get your adductors working a little better. Yeah, put your head on straight. We'll get your neck next time. I know it's not happy, but now rock forward and use these muscles. I want to feel this go straight back right there when you come forward. That's right, and back up again. And again, forward. Make that go back. There you go. So you're sitting, bending way down in your pelvis. Mm-hmm. And back again. Mm-hmm. What are you going to do with your neck? It's all to one side. Go forward again. Made your neck worse when we got your legs straighter. Okay, and back up again. And once more. Right there. Make that go straight back, right there. Use your legs. That's it. And back up again. Yes. Now let me see you rock using those muscles. You go way back in there and back up again. And once more. Legs are looking good and back up again. Now. Come up a little taller right there. A little taller. There. Now come forward again. Same kind of a move. Where you're moving way down in your pelvis. Keep coming. Keep coming. That's it right there. And back. And do that once more. Keep coming. Okay. And back. Okay. Bring your feet back flat again. Now, keep looking at your neck because I don't want you to leave with it that twisted. Come nice and tall here. And turn towards me. Right there.
Yeah. that part is sore.
Yeah. Easy. Just hold it right there. You can twist up out of it. You can pull up out of that. Turn a little more. That's it. And a little more. A little more. Good. Good. That's right. Now come back. That's better. Feel better?
Mm-hmm.